Everyone, Aaron with Perfect Postures. Sorry that I didn't actually post a question of the week last week. I was away, a little vacation, so apologize. But this past week and actually a couple weeks ago, I've had a few people come in that they've come in with a particular symptom, and really those symptoms would be more low back type symptoms, but also having more upper back, kind of almost into the cervical, into the neck region. Now, the reason I'm talking about this is because each one of these people, there's 3 people now, and I just thought this is something worth talking about. They went to see their physician, and their physician said that there's no way that the low back is related to what's happening in their upper back. And I would agree with that in regards to symptoms, but in regards to mechanical causes for the symptoms, I would probably have to disagree with that. And I want to show you a couple things and what I mean by that. And I'm not disagreeing with the physicians, but my expertise is looking at mechanics, muscle imbalances, and joint dysfunction. And a lot of healthcare professionals are really good at what they do, obviously, but they focus on one particular area and they're experts in that area. What we do at Perfect Postures is we look at how one part is directly related to another part. So, for example, when we look at the back, for instance, what we may see is one side of the pelvis higher than the other side. Now, when you look at low back pain dysfunction, a lot of times, let's say the left side's higher than the right side. Well, what's going to happen is that's going to create unequal pressures on the low back through here versus here. Just like if you took a balloon and you put more pressure on one side, although there's compression on one side, inside the balloon, the pressure's going the other way, right? So in that regards, that would be a mechanical cause for the low back. Now, when we look at what happens up here and how this is related to what's going on up here, you may see the pelvis elevated on this left side, and the way the body is going to compensate for that is it actually may depress on this side. Because what happens is your body's going to always try to feel centered. It's always going to try to feel grounded. So that's one way of doing it. So if this side's high, this side may depress. And now all of a sudden what we see here is maybe this shoulder's lower, and then we look at, okay, well if this shoulder's lower and we look at how the muscles attach here and how they come up to the base of the skull here versus this side, there's going to be an asymmetry in regards to the tension of the soft tissue or the muscles on this side compared to this side. So again, as an example, left side's elevated, left shoulder depressed. Well, now all of a sudden there's all this increased tension on the left side of the neck into the mid-back. So that's static. Now when the person's in movement, the shoulder blade, the shoulder itself, and the arm and cervical region is going to be compromised. So this is a perfect example of how one part, low back, can be a culprit to what's happening up here. So that's just something to kind of keep in mind. And again, when you see your physician because of pain, it's important. You need that diagnosis. However, when you look at the underlying causes for the pain or for that symptom, this is where we come into the picture, where our expertise is. So if you have any questions, we've had some pretty good questions and a lot more responses on our Facebook page, and we appreciate that. So if you have anything in particular that you'd like for me to talk about, please submit your questions and we'll definitely get on that. Thank you, and we'll see you next week.